Hey, everyone. It is fresh off the set time, your ultimate podcast here. And I am one of your hosts, Kami Stroop.
And I'm Elora Murray. Thank you so much for listening. Okay, the holidays are here. We love them. But the fact of the matter is, sometimes they can be really stressful. I sat down with Dr. Gordon Harkness from Optum Utah, and we talk about heart stress during the holidays. And a lot of time that heart stress can come from just being stressed out, not eating well. And I mean, Kami, to you, what is the most stressful part about the holidays?
I was going to say, is that what my heart is having palpitations? Am I having stressful related holidays here? Gosh, so many different things. And as I look through this list of things, managing stress, eating better, staying active, like all the things you can do to help all of the stress, I would say one of the biggest things is I probably overly worry about what my gifts are, which the holidays aren't about giving gifts. It's about the memories of making it, making your cookies and doing all the things. Yeah. But I have a almost 5-year-old and all the things. I had such a wonderful childhood and I want to make it special for him. So I think it really ultimately is the pressure you put on yourself.
I think that I could not agree more. And for me this year, what I've had to do, what has been so stressful to me is I have had pretty much the same, similar Christmas my whole life. And now I have a baby and I'm like, okay, I don't have time to do this. I don't have time to do this. And I'm like, but that's okay because now there's a new type of Christmas. And it's kind of letting go of the Christmases that were and opening up space and room for the Christmases that are going to be now with the addition.
I love that.
I'm not always going to be waking up in the middle of the night. And there is going to come a Christmas when he is out with his friends seeing lights instead of, falling asleep in our arms. And so the stress that I was feeling of, this is such a different year, I've had to let that go and be like, every Christmas is going to be perfectly imperfect with my perfect boy.
Absolutely. You got to just roll with it.
There we go. And honestly, that's it. But like I said, Dr. Gordon talks about how you can manage this stress and how you can eat better and stay active so your heart stays healthy during the holidays, because that's one of the greatest gifts you can give to your family is your health. So what do you say we take a listen? Hello, everyone. Okay, I am so excited. We are going to be talking to Dr. Gordon Harkness with Optum Utah. And this topic that we're talking about today is so important during the holidays. Doctor, thank you for joining us.
Thanks for having me.
Of course. All right, we're starting off right away with a really intense question. Can you start by explaining why the holiday season poses a higher risk for heart attacks?
Yeah, it's a great question because we do see a higher numbers of heart attacks and other heart-related things during the holidays. I mean, it's supposed to be a time of joy and happiness and celebrations and all this fun. And I think sometimes those expectations can lead to extra stress, can lead to maybe not making as good of choices in terms of our diet and exercise, and maybe skipping some of our doctor's appointments and those types of things. And all of that can add up to an increased risk of things like heart attacks and other heart-related conditions occurring during the holidays.
Yeah, and I mean, like you said, the holidays are supposed to be joyous. They're supposed to be filled with love and happiness, that holiday magic, but that stress does happen. It happens. It's a thing. So in your expert opinion, what steps can people take to manage that holiday stress so they can protect their heart health during, such a busy season?
Yeah, I think the first thing is to just not put too many expectations on yourself. Recognize that this is a fun time of the year, but we can't do everything. And so setting some expectations. I think also just taking some time to make sure we're still engaging in those activities that help to keep us healthy to begin with. Sometimes we get so busy during the holiday season that we stop exercising, or maybe because of all the fun treats and foods and traditions and things, we overeat and we eat differently than we normally do, and that leads to maybe that post-meal hangover, so to speak, where we don't feel as good, and then we don't exercise, and that leads to more bad habits, and it just can kind of build up. So I think the main thing is just giving ourselves some space to recognize this is a fun time of year, but we don't have to do everything, and making sure that we try to at least keep some of our regular good habits going during this time of the year.
Yeah, I mean, we don't have to do everything, and we can't do everything, and that's something to remember, mentally and physically as well. So, are there any specific, lifestyle changes or habits people should adopt, leading into the holidays that can lower their risk?
Yeah. Well, I think just eating a healthy diet, making sure that we're not overdoing it with unhealthy fats and cholesterol and all those types of things. I think, if you aren't already exercising, sometimes people get into the mode of thinking, okay, I'm going to be healthy. And so they just jump in feet first and go full bore. And then maybe get an injury or something like that. I think it's important to kind of step into something that's different, like exercise slowly and gradually, so that you don't cause any extra problems. But it's always a good time. This is a good time of the year to get engaged in walking. If you want to find some exercise and you haven't been doing things regularly, just getting out and walking when it's the weather's nice enough outside, spending time with family and friends and activities that kind of get your heart rate up a little bit, but not overdoing it. Mm-hmm. And then again, just maintaining, healthy habits, making sure you're not overeating, and that it's okay to indulge a little bit in some of the treats and those kinds of things, but that shouldn't be our whole meal.
Yeah. Well, and I was going to say, I mean, it is the holidays. Like, let's be completely realistic. I mean, we do have and I feel like it's such a winter thing. I mean, that comfort and holiday food tend to be just a little heavier. There are treats galore. That seems to be one of the ways people show they care, is by giving treats.
Yep.
So, and this next question, exercise is a really big thing for me. It helps me so much mentally. So I'm a big proponent for it. But can you talk about how the role of nutrition and exercise together, how they work in maintaining heart health?
Yeah, well, and even not just alone with heart health, but just in general. I know that, let me speak from my own experience. When I'm exercising regularly, I do feel better, and I'm more likely to make good, healthy eating choices as well. And as I'm eating right, I feel better, and that leads to me wanting to exercise more. And so there's kind of this cycle that is that if you get into doing those healthy habits, it kind of keeps you doing those healthy habits. On the flip side, the opposite I find is totally true as well. When I've maybe overindulged a little bit and I'm not eating as healthy, I just don't feel as good, and so then I don't exercise and I don't take that time to get outdoors and do things. And another point I'll just make is sometimes there's the tendency during these winter months, when it starts to get cold and it's dark earlier, we tend to want to just stay indoors and not do as much outside. And certainly you can exercise inside, but I don't know, personally, I just find getting outside when the sun's out, even if it's cold, making sure I'm bundled up well and making sure I've got good footwear so I'm not going to slip and fall and cause an injury that way. But just being outside and breathing in fresh air, getting a little bit of sunlight is such a good thing and is so helpful in feeling healthy and in actually being healthy as well.
Absolutely. So we've talked about, what we can do to help our heart health and kind of, protect our hearts, not just, during this busy holiday season, but all year round. What if someone, and I mean, it's hard to talk about, but you need to know, what are the early warning signs of a heart attack, and why are they so often ignored during this time of year?
Yes. I think, again, the ignoring it part comes down to, well, you might just feel a little bit off, but you got this big party or something going on, you're feel obligated to be a part of. And so sometimes we ignore some of those early warning signs. Typically, when people are going to have a heart attack, there's some very specific signs that certainly are concerning. If you're feeling chest pressure, and usually people describe it as a pressure or pain, it's not typically a sharp stabbing pain, but more like just feeling crushed. You're just feeling crushed in the chest area, but also shortness of breath, sometimes nausea, sometimes sweating, sometimes there's pain that radiates from the chest into the left arm. Now, that's not always the case, and so not having that doesn't mean you can just say, oh, it must not be my heart. But anything that just feels kind of off, you ought to get it checked out and just make sure, because sometimes it's interesting for some people. they may be having a silent heart attack and they don't even have any major symptoms. They're just little minor things. And so I think it's important not to ignore those little things that are different than what we're accustomed to feeling. If you just feel off, it's not a bad idea just to get it checked out, even if it's just at an urgent care or with your primary care provider. Just don't ignore it. Make sure you're getting it checked out.
Okay. And I mean, you talked about this a little bit. Lots of times people ignore it because they have so many commitments. It could be a party. It could be, a family event. It could be so many things. But what would you say to someone who is feeling so unwell, but they're like, you know what, I don't want to seek medical attention. I have too many things to do. What would you tell them?
Yeah, I mean, I hate to be a downer on this, but I think you need to look at it in terms of your long-term future. I mean, is it more important to miss something right now to make sure things are checked out and you're healthy for the future versus ignoring it and then maybe having this sort of be your last holiday with somebody? I mean, these heart attacks can be very serious things, and so I think just keeping that perspective that you're going to enjoy things better if you're healthy, and if there's something that's not right, let's get it checked out so that if there's something that needs to be done, it can be taken care of, and then you can continue having that healthy life afterward.
Absolutely. And like you said, it's kind of hard to talk about, but there's facts and there's a reason why you need to go get help. Let's talk about the technology a little bit. So a CT scan can estimate heart attack risk. Can you talk to us about how this works and who should, consider getting one?
Yeah. There are some new technologies and new different types of tests. There's many different ways that a person can be evaluated for heart risk. And at the end of the day, really what we need to all be doing is just making sure that we're visiting with our primary care provider and letting them know what's going on with us and what risk factors we have, and then they can determine which tests are going to be the best ones for us. The CT scan, this coronary artery calcium CT scan, is a test that's emerging that's really helpful in certain situations. Basically, in our coronary arteries, the arteries that feed the muscles in our heart, we can develop plaques, and these plaques can sometimes rupture, leading to a heart attack. One of the things that's been noticed is that these plaques that are at higher risk often have more calcium embedded in them, and so these CT scans can help. They can see this, and you get a score or a number that is sort of an estimate of your risk of having a heart attack or stroke in the future. Because of that, some people thought, oh, this is a great test. I should just get this test and then I'll know what's going on. It's actually not a test for everybody, but in the right situation, it can give additional information that can help determine what somebody's risk is. So before getting that test, you really ought to be, like I said, evaluated by a doctor. They should be looking at things like your cholesterol levels, your family history, other risk factors like, do you have diabetes? Do you smoke? Other things that can lead to a higher risk of heart attack, and managing those things. But in certain cases with certain individuals, these CT scans can be very helpful in kind of tipping somebody one way or the other. So just as an example, I had a patient who had fairly elevated cholesterol levels, and by the normal standards, you'd say, yeah, these should be on something to help lower your risk. But in her particular case, she really had no family history of heart attacks, and she kind of questions, is this something I need to do? Is this something that is really important for me? And so we landed on, let's get this coronary artery calcium test and see what it shows. And that helped her in determining what was the best course of action for her.
Okay, and that's a great example, because I was going to ask you who this test is good for. So if it's like that patient you just talked about, if someone needs to take this type of scan, how can they access it, and should they schedule it before the holidays? How does that work?
Yeah, so it's going to be something that a physician or another medical provider is going to order based off of certain criteria. So really, the first step is to just talk to your provider, talk to your physician, and they can determine what tests need to be done. And if this is one of those tests, they'll go ahead and order it, and then this gets done, at the hospital or at some other imaging center. This is not the type of test that typically just happens in the physician's office. It's something that'll be ordered, and then it'll be scheduled for another day.
All right. And so we just talked about, technology, how that can help us, our lifestyles, how that can help us as well. What are some misconceptions about heart attacks and heart health that you come across a lot?
Yeah, there's kind of two things I hear, and they're related, but they're on opposite ends of the spectrum. So sometimes I hear people say, "Well, I'm eating right, I'm exercising, I'm doing all the right things, therefore I don't have any risk for heart problems." And as a result, they may ignore some of the issues that may be tipping them off that there's an issue going on. On the flip side of it, occasionally I hear people say, "Oh yeah, my husband or my spouse, they don't eat healthy, they don't do all the right things. That's why they had their heart attack." And it's more complicated than that. But what I'll tell you is that there are people who engage in all the right activities. They eat right, they exercise, they do all the right things, and yet still they can have a heart attack. And so it's just important to understand that while it's important to eat right and exercise and engage in healthy activities, that doesn't eliminate the possibility of having a heart attack or some other heart-related condition. And so again, you don't want to ignore the signs and symptoms of a potential problem just because you're already doing all the right things. There may be other things that could be done in addition after an evaluation with a physician.
Okay. So are there specific groups of people who should be, really vigilant about their heart health during the holidays?
Yeah, I think certain conditions like diabetes, or if somebody already has some sort of heart condition, they do need to be extra careful. We do tend to see more of these types of events and problems with the heart as people get older. So the elderly have to be particularly careful. And then if there's other risk factors like smoking, or if you're just very sedentary, you just need to be careful about all that. And again, if there's any inkling that there could be an issue, it's just always the best to get it checked out.
Okay. Perfect advice. So if someone is concerned about their heart health, like right now they're like, you know what, maybe I haven't been eating healthy, I haven't been exercising enough, there's a history of this in my family, whatever it may be, the different things we've been talking about. If someone is concerned, what steps should they take right now to get evaluated or even lower their risk of heart-related issues?
Yeah, I think the number one thing is make sure you get in to see your primary care provider. If you don't have one, you can always establish with one and see them to kind of get the ball rolling. Typically, people don't need to go straight to a cardiologist unless they're having very specific symptoms. Usually, you can go to a regular primary care provider and kind of get checked out. I think that's, it may be a little harder to get into a provider during the holidays, but I think it's important to get that appointment scheduled so you don't put it off too far. And then I think just, engaging in some healthy activities, exercise, and just trying to eat healthy. Anything you can do now is a positive thing for the future.
Absolutely. And I mean, coming from someone who loves exercising, this is a great time of year to exercise because there are some great holiday tunes to walk to. Whether you're, lifting weights, doing yoga, running, there's some great ways to get your body moving. So
podcasts and other things like that. It's all great.
Yeah. And that can really help you. That helps me exercise a lot. So doctor, you've given so much great advice and really tactical things that people can do to help their hearts. What is one message that you want listeners to take away from hearing this about the importance of prioritizing their heart health this holiday season?
Yeah, everything you do makes a difference. It really does. You may not notice the difference right away, but it does make a difference. Things that you do now to be healthy, maybe it doesn't impact things for 5 to 10 years, but it does eventually impact. And so, I heard somebody once talk about how people are willing to wear glasses or to have corrective lenses, contacts, whatever, because they notice the difference immediately. You take those glasses off and immediately you can't see well again. Sometimes that's not the case with things like heart health or with diabetes, where you do the right things and you don't necessarily feel all that different right away. But I can tell you that over time, over days, months, years of just doing the right things for your health, it makes a difference. So anything you can do now that is a positive thing, a good habit to establish, whatever it might be, will make a difference in the long run.
I love that. And it's something I always say. And I mean, I'm not a doctor, but generally in life, I always say ripples make waves. So those tiny things can end up making a huge difference. And, if you're not exercising now, you don't have to start exercising 7 days a week for an hour. That's just not going to happen. But it's those tiny movements, those tiny choices. Maybe I will have some more protein instead of this delicious holiday cupcake, or, things like that. It's those tiny choices that make the biggest difference. Like I said, ripples make waves.
Even just going for a walk for 5 minutes or 10 minutes, starting at that point can make a huge difference over time.
And I mean, for me personally, I had a baby a few months ago, and my exercising looks different. But if I still exercise a small amount every day, it makes a bigger difference than if I just thought, I don't have time to do any of this.
Exactly.
I love it. Okay. Well, doctor, thank you so much for your great advice. I mean, talking about heart attacks and heart disease it can be a hard topic, especially for a lot of people out there. But thank you for taking the time and, giving us these facts and these tips and advice. We really appreciated it. And everyone for listening, thank you so much. Please rate, review, and subscribe, and happy holidays.
Congrats, you made it to the end. If you want to continue to freshen up your day, you can watch us on Fresh Living every weekday on CBS Channel 2 in Utah at 1 o'clock. You can also watch us on our YouTube channel, KUTV Fresh Living, and follow us on social media. We will see you next week.